Aging is an inevitable part of life, but for many seniors in the United States, it is accompanied by a sense of loss, decline, and frustration. The process of growing older is often misunderstood, and there are aspects of aging that doctors may not fully discuss with their patients. While many seniors rely on their healthcare providers to guide them through their aging years, the reality is that there are certain things your doctor may not tell you, either out of optimism or lack of awareness. It's crucial to prepare yourself for aging both physically and mentally before it is too late. 1. The silent decline of cognitive function. As we age, our brains undergo changes that can affect memory, concentration, and overall cognitive function. Doctors may downplay this reality, but it's important to acknowledge that some cognitive decline is normal and can happen gradually, often without any outward signs until it becomes a major issue. Mild cognitive impairment, MIN-CI, is one of the first stages of decline and may lead to conditions like Alzheimer's disease or dementia. While some cognitive changes are normal, there are things you can do to mitigate their effects. Doctors may not always emphasize the importance of mental exercises, social engagement, or dietary changes in preventing cognitive decline. Brain health can be preserved by staying mentally active, eating a healthy diet rich in antioxidants, omega-3 fatty acids, and B vitamins, and getting enough sleep. In addition, regular physical activity has been shown to improve blood flow to the brain, helping prevent neurodegeneration. 2. The truth about aging muscles and joints. Another aspect of aging that is often understated by doctors is the loss of muscle mass and joint function. Sarcopenia, the gradual loss of muscle mass, is a natural part of aging, and it can be worsened by sedentary lifestyles and poor diet. This reduction in muscle strength not only leads to physical weakness, but also affects balance and mobility, increasing the risk of falls. Furthermore, joint problems such as osteoarthritis or degeneration of cartilage are common as we age. While doctors may offer pain-relieving treatments such as medication or physical therapy, they often don't stress enough the importance of preventive measures such as strength training, flexibility exercises, and weight management. Regular exercise helps maintain muscle mass and joint flexibility, both of which can improve your quality of life as you grow older. Ensuring that your body is supported by strong muscles will help mitigate the long-term effects of aging. 3. The impact of hormonal changes. Hormones play a crucial role in how we feel, look, and function. As we age, particularly in the senior years, there is a natural decline in hormone levels, especially in men and women over 50. For women, menopause brings about significant changes in estrogen levels, leading to symptoms like hot flashes, night sweats, and mood swings. Men experience a more gradual decline in testosterone levels, often leading to fatigue, reduced libido, and even depression. Doctors may not always address the emotional toll these hormonal changes take on seniors. It is important to note that while hormone replacement therapy, HRT, can be an option for some individuals, it is not without risks. Furthermore, lifestyle changes like adequate sleep, stress management, and exercise can help alleviate many symptoms associated with hormonal changes and should be discussed thoroughly before jumping to medical interventions. 4. Decreased immune function and the risk of chronic illness. Your immune system weakens as you age, making you more susceptible to infections, viruses, and chronic illnesses like heart disease, diabetes, and cancer. This phenomenon, known as immunosenescence, is not always fully explained to aging adults. While vaccines, such as the flu and pneumonia shots, may be recommended by your healthcare provider, many seniors don't understand the full extent to which their immune system declines over time. In addition to vaccination, eating a nutrient-dense diet, managing stress, and staying physically active are critical to maintaining immune function. Chronic illnesses are often preventable or manageable through lifestyle changes, but many seniors don't take enough proactive measures until the illness has already taken root. 5. The importance of preventive care. One of the most critical things your doctor may not tell you about aging is the importance of regular, preventive care. Many seniors tend to see their healthcare providers only when they are sick or experiencing symptoms. However, aging is not just about managing disease when it arises. It is about preventing disease and maintaining overall well-being. Regular screenings for things like high blood pressure, high cholesterol, and cancer can detect early signs of potential problems before they become severe. Moreover, early intervention can improve quality of life and extend lifespan. Preventive care is not just about visiting the doctor, but also about paying attention to lifestyle habits, maintaining a strong social network, and nurturing mental health. 6. Social and emotional well-being. Doctors often focus primarily on physical health and may neglect the emotional and social aspects of aging. However, these elements are just as vital to living a long, healthy life. Loneliness and social isolation are common among seniors and can lead to depression, anxiety, and even cognitive decline. The mental health of seniors should be a priority, but it's often overlooked in favor of physical ailments. Building strong social connections, engaging in regular activities, and seeking mental health support are critical components of healthy aging. Finding a purpose, whether through hobbies, volunteer work, or spending time with family, has been shown to improve longevity and reduce the risk of mental health issues like depression. 7. The need for financial planning. Another aspect that is often left out of the conversation is financial preparation for aging. Many seniors are unprepared for the financial burden that can come with retirement and aging. The costs associated with healthcare, long-term care, and assisted living can be astronomical. However, doctors and healthcare providers rarely discuss the financial implications of aging or the importance of planning for these expenses. Starting early with financial planning, investing in long-term care insurance, and consulting with financial advisors can help seniors avoid financial hardship in their later years. It is essential to consider the long-term financial impact of aging and take action before it becomes too late. 8. Aging is a holistic process. Aging is a multifaceted process that requires a comprehensive approach. The focus on only one aspect, such as physical health, can leave many other areas neglected. To age well, seniors must take into account not just their bodies, but their minds, emotions, and financial stability. Healthcare professionals may give you a diagnosis and treatment plan, but it's up to you to take control of your aging process. Doctors may not always share the full picture of aging, and that's why it's essential to actively seek knowledge and engage in healthy habits. Staying proactive, investing in your health, and seeking holistic care will allow you to thrive in your later years rather than merely survive. In conclusion, aging is a complex and individualized experience, and while medical professionals provide valuable insights, there are many aspects that may go unaddressed. It is important for seniors to educate themselves on the realities of aging and take proactive steps to maintain physical, mental, and emotional health. Preparing for aging before it is too late can not only improve quality of life, but also extend it. Ultimately, the more you know and the more you prepare, the better equipped you will be to navigate the challenges of aging and embrace the opportunities it brings. As you embark on your journey of aging, it's important to take charge of your health and well-being. Don't wait for symptoms to arise before seeking advice or making changes. Start today by discussing your health concerns with your healthcare provider, investing in preventive care, and committing to a healthy lifestyle. Remember, aging doesn't have to mean decline. By staying informed, active, and proactive, you can age gracefully and with vitality. Talk to your doctor about potential preventive measures and screenings. Stay active by engaging in physical exercises that promote strength, flexibility, and balance. Nurture your mental health through social connections, hobbies, and seeking support when needed. Plan for your future by taking financial steps to ensure your comfort and security in later years. Take these steps now, and you'll be well prepared for the challenges and joys of aging. Start making those small changes today for a healthier, more fulfilling tomorrow.